Okay, dear student, in the previous class, I have discussed about parasympathomimetic drug that generally act on parasympathetic nervous system comes under autonomic nervous system. They showed their action generally by promoting the sympathetic nervous system action by binding with different cholinergic receptor which generally act or helps to show the action of parasympathetic nervous system act by them. So today we are going to discuss about parasympatholytic drugs which are going to the doing the opposite work is that of sympathetic nervous system or parasympathetic nervous system by binding with or by blocking the action of cholinergic receptor. So today's topic is parasympatholytic drug. So from that name only you can understand parasympathetic, it comes from the parasympathetic nervous system and the lytic is means oppose or the opposite. So that parasympatholytic drugs generally showed their action that is the opposite action of parasympathetic nervous system. How generally show their action? They showed their action generally blocking the different cholinergic receptor. In that I have already told what are the given receptor, nicotinic receptor and muscarinic receptor. In that also neuron type and muscle type are there, and in muscarinic M1, M2, M3, M4, M5 is there. Their position and their action you can study from the previous video, especially from that video where I have discussed about the introduction of autonomic nervous system. Please go through to better understand the action of nicotinic and muscarinic receptor. Today's topic is parasympatholytic drugs. That drugs are also known as cholinergic antagonist. Also they are known as cholinergic receptor blockers, or also they are called as anticholinergic drugs. So what are the different and other names of parasympatholytic drugs? That are also known as cholinergic antagonist drug or cholinergic receptor blockers drugs, or also known as anticholinergic drugs. So now I am going to discuss about the physiological action of parasympatholytic drugs. So in previous classes only I have discussed about different physiological action of autonomic nervous system, and in that sympathetic nervous system also I have discussed, and autonomic nervous system also, and parasympathetic nervous system action also I have discussed in previous two classes. About that parasympathetic nervous system action I have already discussed into the parasympathomimetic topic. Again I am just reminding in short. They showed their physiological action in CBS. How they are showing? They generally promote the blood pressure and cause vasoconstriction, and they also increase the tone of AV node. In eye, what they generally do? In eye, they generally dilate the pupil. The dilation of pupil is called as mydriasis. In GIT, what they are generally used to do? They decrease the motility of intestine, GIT tone, and also decrease the secretion from liver, pancreas, salivary secretion, etc. In respiratory system, they generally cause vasodilation, that can lead to asthma. So these all are the physiological action that is generally showed by parasympatholytic drugs. Now we are going to discuss about the therapeutic effect of parasympatholytic drugs. So what are the different therapeutic effect or therapeutic usage of parasympatholytic drugs? They are used to cause mydriasis or constriction of eye pupil. They are also used as anti-Parkinsonism drug. That means these drugs are used to treat Parkinsonism, that is generally caused by dopamine secretion and leads to the epilepsy or memory loss. That can also be treated by parasympatholytic drugs. They are also used as pre-anesthetics drugs before the surgery to do anesthesia. Before that anesthesia, they used to give parasympatholytic drugs, and they are also used to treat motion sickness. Many people have sickness or they feel nausea or vomiting during travel by bus or car for a long period of time. To treat that motion sickness also, parasympatholytic drugs are also used. And one more therapeutic use is it also used to treat peptic ulcer. Peptic ulcer is a small incision or more small inflammation into a part of peptic area due to the over accumulation of peptic gases and peptic acid and hydrochloric acid. It leads to peptic ulcer, and other ulcers are also there, but generally used to treat peptic ulcer, that parasympatholytic drugs generally is used. So what are the therapeutic usage? It is used to causes mydriasis. It is used as anti-Parkinsonism drug. It is also used to treat as pre-anesthetic agents. It is also used to used to treat motion sickness, and it generally used to treat peptic ulcer. So these are all the famous usage where we generally use parasympatholytic drugs. So now we'll go and discuss about the different adverse drug reaction related to the parasympatholytic drug due to their over usage or due to their accumulation into our body. So let's get started about the adverse effect or ADR related to sympatholytic drugs. It can causes blur vision. Then it can cause dry mouth. It can cause hallucination or dizziness. It sometimes causes hypertension due to over and excessive use. Disease also can cause constipation, because I have already told that they generally decrease the peristaltic movement or intestinal tone or intestinal motility, that can lead to the constipation. So what are the ideas? Because that parasympatholytic can causes glaucoma, so they can lead to the blur vision or vision loss. It can cause also dry mouth due to the increase of body temperature. It can also hallucination or dizziness. It can cause hypertension, because we have already told that parasympatholytic drug generally used to increase BP by doing constriction of cardiovascular system or blood vessel. So it can lead to hypertension due to the excessive use of parasympatholytic drug. And I have also told that parasympatholytic drug used to decrease the peristalsis movement and the tone of GIT or the tone of intestine, that can lead to the constipation. So these all are the adverse drug reaction. Now at the last we will discuss about some famous example of parasympatholytic drugs which are generally used in our life. So now go through into that. So now we'll discuss about the example. What are the example? Atropine. That is the most useful and most important drug and mostly used as a parasympatholytic drugs in our daily life. Another example is scopolamine. Then there are also ipratropium bromide or ipratropium chloride, protropium, hyoscine, and another example is dicyclomine. So these all are the different and famous example of parasympatholytic drugs which generally used by us in our daily life. What are they? They are atropine mostly used, then scopolamine, ipratropium bromide, it is used to treat asthma. Then we also use protropium bromide, that is also used to treat asthma. Then hyoscine, and another more example is dicyclomine. So in these classes I have discussed about parasympatholytic drug, how they have shown their action, how they generally block different cholinergic receptor, what are their physiological action, what are their therapeutic effect or therapeutic usage, what are the adverse drug reaction related to the overuse or accumulation of parasympatholytic drugs into our body, and what are the famous example of parasympatholytic drugs which are generally and predominantly used in the daily life of human. Those drugs also we have studied into the last slide. But many times when I have discussed about sympatholytic drugs, sympathomimetic drugs, parasympathomimetic drugs or lytic drugs, you generally heard two terms, that is myasthenia gravis and glaucoma. And sometimes your mind can ask you that sir always used to talk about myasthenia gravis and glaucoma in different classes, but what they really mean? What is myasthenia gravis or what is glaucoma? Just in short, I can tell these are the some effect or adverse effect or some drug that myasthenia gravis is generally due to the autoimmunity, and that glaucoma is related to the disease of eye. Let's discuss about what is myasthenia gravis, what is glaucoma, what are the possible reasons for the causing of myasthenia gravis and eye, what are the different symptoms by which we can understand that some people is suffering from myasthenia gravis or someone is suffering from glaucoma. All the symptoms we are also going to discuss, and then we will discuss about the myasthenia gravis and what are the different possible medication used to treat that myasthenia gravis and glaucoma, and what are the different adverse drug reactions related to the different drug that is used to treat myasthenia gravis and glaucoma. So full total about the myasthenia gravis and glaucoma I am going to discuss into the next classes. Please going through that parasympathomimetic in the previous classes and parasympathomimetic lytic drug and previously sympathomimetic drugs and sympatholytic drug to better understand the topic of myasthenia gravis and glaucoma, which I am going to discuss into the upcoming classes. Thank you.